Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Welcome back, everybody, to another Practice Plan podcast. My name's Hussein. Some of you have maybe listened to me before. And for those of you that haven't, I am an associate dentist and I work in York. And today for you, we have Aditi, who's very kindly decided to join us and tell us about sort of her approach to dentistry, her journey, and the reasons why she's decided to go on sort of this route and bring the rest of us along with her. So, Aditi, please introduce yourself and tell us about yourself as well.
Thank you, Sen, for having me. It's such a pleasure. So I am a prosthodontist and I am also an integrative psychotherapist with over 15 years in dentistry and extensive, mind-body movement experience. I am so passionate about bringing preventative well-being tools to dental professionals. I have paused my dental practice for now because of suffering with Deca-Raines tenosynovitis, a very painful wrist condition, but it's just a pause. So this is me.
Oh, fantastic. So you sort of speak about obviously all being a sort of a specialist prosthodontist that clearly has taken a lot of training. What sort of implemented you to actually sort of go do sort of more training, but in obviously an area related to dentistry, but also unrelated to dentistry?
Yeah. So I suffered with my own burnout, anxiety, perfectionism. And because of my burnout and anxiety, I broke down, I shut down. This was 9 years ago. And that led me on my own journey of wanting to understand myself better, understand why the idea at the time was, why did I fail in essence? Why could I have not managed this better? So to understand what I could have done differently, I started to learn. Now, learning as just a student wasn't enough. The geek in me wanted to learn it from a therapist's point of view. So I went on several courses, several trainings, all for my own personal benefit to understand how I can keep supporting myself better. And as I went on this journey, this little spark started within me that, I wish there was more of this knowledge out there for us. So we would never reach burnout. We just wouldn't hit rock bottom. So I had this little spark that, I wish I could just blend this in with dentistry somehow. So I started sneaking in a bit of breath work, a bit of meditation when I was lecturing with HE and QMUL. And yeah, people seemed to love it. They really enjoyed it. And that sort of sparked my interest and love for it even more. And I kept going deeper, it started all with me. And now it's all about wanting to spread that knowledge with others.
Fantastic. So I'm going to touch upon, you sort of talk about perfectionism, which is obviously a big thing. And I think that's probably comes into your came into your dentistry even more being a prosthodontist. And I expect this is kind of what a lot of young dentists seem to fear at the moment. They sort of come out of university and they think everything needs to be almost perfect because they have to attain this kind of standard. And I think the first thing I'd also mention is this is very much the kind of, AI world and the social media world, and everyone sees this kind of fantastic work that's produced. So I'm actually going to ask you about perfectionism first, which is something that we didn't think we were going to talk about, but you've sort of mentioned it. What's kind of your main tips? Because I suppose perfectionism is almost kind of one key component of burnout.
Yes, absolutely. Wanting everything to be perfect. Well, that's the thing. That standard keeps changing. The goalpost keeps changing because 1 minute you think this is perfect and next minute it might be something else. My tips for it is the one tool that helped me the most was understanding and applying compassion to myself. Because if you practice dentistry long enough, or even if you live long enough, you're going to make mistakes, you're going to fail. And that's the reality of life. Again, something we are not taught about, right? We're not told that this is going to fail. We're told about, maybe we're lectured about how to manage the failures. But that deep sinking understanding of things are going to fail, it's going to happen, and that's okay. This is how we manage it. That part is missing, that compassionate part of this is okay, it's going to happen, but you can manage it or you can prevent it. So I think people coming into dentistry, I think it's sort of like a tick box that you are a little bit of perfectionist, and definitely then training as a prosthodontist where you're obsessed with 0.5 millimeter of margins doesn't really help. For the younger colleagues, I would say that step back, take a step back, see where you are on your journey within dentistry. You've just started out. Maybe, the photographs you're saying, as you said, AI is in the play now, which is really hard to sort of navigate, address. But really take a step back. If that is your goal, that you want to get to, this level of doing a procedure, train, learn. But the obsession shouldn't be just getting perfect. It should be giving the best results to your patients within your capability. And we all have different capabilities. So that acknowledgement, I feel, is really important with perfectionism.
I like the way you say train and learn, because one of the things, because I'm sort of slightly special interest, and my main thing is removal prosthodontics, but that does obviously include some fixed as well. I actually never went on a crown prep course, but yet I seem to feel like I produce a good crown prep, and the reason why isn't because I went on a course. And I think a lot of people will actually go on one singular course and they'll just tout that course saying it's the best thing they've ever done. My actual thing is I just watched sort of a bunch of webinars, just took lots of little tips and tricks, and actually just compiled my own kind of methodology for what works for me. And I think that's an important thing, is that, you talk about journeys, and you talk about the way people do things. But it's not always a case of one size fits all. You have to basically find the ways that work for you. And I think that's kind of the nice way of kind of approaching the next question, which is, the way that you sort of approach what you sort of preach and the techniques that you cover. So tell us about kind of what you've set up so far, and talk us through kind of I think you've got sort of social media. I'm not sure if there's a website as well. But yeah, tell us about kind of what it's called, why you've called it, why you've come up with this name, and sort of what brought you to set it all up in the first place.
Yeah, so last year I set up, it's all started with a Facebook group. The intention, the seed had been planted, I would say 2019, but it kind of flourished just last year. The group's called Dental Wellbeing Hub, which is now soon going to be converted into sort of like a portal on a website. So it's all coming this year. The reason why I called it the Dental Wellbeing Hub is because we see well-being as something very detached from your daily life, or very, your routine or your work, whereas both need to function together, both need to merge in together and go together. There has to be this balance. Again, it's not about perfectionism. So we say, oh, to switch off, we've got to have spa days, we've got to have, teas and all. Yes, all of those things are really important. But for me, it's about small, regular, consistent steps every day. So I set up this group with one mission, that I want to focus on prevention, simple tools, but also creating a community where we all can come together and we can talk about these things, and we can talk about the importance of these things, and we can do them together as a group. I also have a website, which is basically my name, draditibhalla.com. And I work with people one-to-one. I work within group setting. I do a lot of speaking, lecturing, but I also host these monthly well-being webinars, where we will together uncover and understand and learn a tool that you can then take back within your practice. So it could vary from breath work to some yoga inspired movements to hypnotherapy, meditation, and more. There's so much more coming this year. So this is where I am.
This sounds really good, because I think the thing about Aditi is, what's really interesting is not about, his session about, well-being. Here's some ideas, go away and try it, or here's a toolkit, go and use this toolkit. It's actually gives people the chance to explore techniques and methods, and you can actually try out for yourself what works for you, because we've already said, it's not a one size fits all approach. Everyone kind of, there was a big kind of preachy phase of mindfulness, and there's a lot of people, I've heard so many people say, actually, it doesn't work for me. But there are also, say, different forms of mindfulness. It's not about sitting in a silent room And it's, and that's why it is about finding your techniques. But when you say, hypnotherapy, and sort of compassion-based learning, but, you've also done, I think, artwork.
Yes.
Um,
We've had, we are going to be having a session on nutrition. We've had coaching and NLP. We've had someone who actually took a sabbatical themselves and is talking about well-being. So we've had many different people come in as well. It's not just my own perspective, and they're all other dental professionals. So we're all sort of coming together. But I've just sort of laid the groundwork. But yeah, there's more. There's nutrition coming. There is physical health coming in there. There is breath work coming in. So there's lots of different elements for people to come and try and see what works for them. And you're absolutely right. Meditation didn't work for me in the beginning because I was trying to do it a certain way. Whereas there are so many ways to meditate, there are so many ways of doing one same thing. So it's about having that 360-degree, that approach and understanding, oh, I can do it this way. This works for me better. And not thinking that, oh, this doesn't work for me, because I'm sure within the kit bag that I offer, which is sort of like you can dip into something, I'm sure, and that'll be beneficial for you.
No, it sounds really interesting to actually try out different things, and especially kind of, with this time of year, because it's, we're now recording in January, and we have sort of SARD, we have kind of people with light issues and things like that, and vitamin D deficiencies, because of time of year and so on. So different approaches actually makes all the difference, and sleep is one big factor as well, because they do actually say for healthcare professionals, people who don't manage to sleep well, or kind of sleep deprived, or have some sort of chronic insomnia, they're actually less empathetic. But it's not just about just saying sleep hygiene, because again, sleep hygiene is another buzzword, but it's not a one size fits all approach, despite what everyone says, that you shouldn't use your phone, for an hour or two before bed, or have screen light or whatever. Actually, my thing is I fall asleep better because I've got something to distract me and take the thoughts out of my head. And that's why I think, your approach of sort of all these sort of other things that people can try for themselves is interesting. And as I say, it's all about exploring. And I guess you're taking people on a journey with you. How did you actually find all of these different things then? Was it just experimentation? Was it research? Was it just things that you've tried yourself?
A bit of both. So because I did a bit of my schooling in India, we had yoga in school, yoga and breathwork in school from a young age. But obviously as a child, you don't really, you think I would rather go play and jump around. So I thought, oh, everyone keeps talking about meditation. Let me go back to it and see how I feel. My mom's quite spiritual, so she sort of used to do these things for herself. And I said, you know what, there's no harm in exploring and seeing. So I kind of did a bit of my own research and also experiencing. I think that own personal experience for yourself and seeing that this works for you, it actually feels good. That's what was sort of instrumental in me saying, oh, I feel good after, having done it, having tried it. Now I want to go and explore more of this. So yeah, definitely that personal experience, which is what I'm so keen on in bringing others as well. This is why spreading this work in the dental community, because I am a dentist. I understand the struggles. I understand how busy life gets. I understand the shame, the self-criticism, the perfectionism. And this is why I just feel that your own personal experience, of you having to come, sit down in a community, not feeling alone, and then experiencing these tools, then you can build on it. It's like building blocks.
This is obviously another important thing you've said, about creating a community. We see, people hosting other webinars, or hosting kind of sessions, or CPD events, or they're kind of there as part of a conference, or show or exhibition. So how, and you speak about kind of trying to do sessions online. How do you feel that creates kind of a social element to everything, and creates community, even though it's through a screen?
Yeah, it's a good question. I think we are so much behind our screens nowadays, isn't it? For me, being in person is obviously amazing. You get to sense the energy of everyone. The experience is different, yes. being on Zoom, the experience is different, but that's not to say that it's bad or it has less benefits. I think when I was contemplating doing in-person events versus doing it on Zoom, for me, it was spreading out more. People are always saying, oh, all the events are happening in London or around London. But what about people setting up in Scotland? I want to reach them as well because dentists are there as well. So it's about reaching more people. It's about creating that, spreading the wings wider and, involving everybody in the community. For me, that was very important. So yeah, I definitely see the benefit of meeting in person. It's got amazing benefits, but also that's not to say that Zoom isn't good. People still find it very beneficial. People still love it. And yeah, it's something they heavily rely on as well, especially in today's world where we are so connected to the digital world, aren't we?
I think that's very true. And I think the other thing that's sort of difficult is that there sort of seems to be three very sort of central areas of dentistry that seem to be focused. And it's kind of London, then it becomes Birmingham and Manchester. They're kind of,
Yes.
there's the centers of the dental world. So it's great that you're trying to reach as many people as possible. And at least, it feels like, even though it's through a screen, I suppose you see faces, so you can still sort of see expressions. You can still see the way sort of people are on the rise. And I think that makes a difference. I guess our next thing is going to be, right, how do people come across your sessions and how do we join?
Yeah, so all the information is on my website. So if you can leave a link at the show notes, that'll be great. But my website is www.draditibhalla.com. And if you go, there is a whole section about the Dental Wellbeing Hub. You can come join us on our Facebook group, and that you can get updated about all of the free events over there. And yeah, all of the information's on there.
Excellent. So for anybody that wants to join Aditi on her next sessions and find out when they are, please do go to her website and take a look. I guess that brings things to a close for today. Aditi, is there anything else you'd like to say before we finish?
No, thank you so much. Thank you so much for having me here and letting me talk about all of my work.
Brilliant. It's really great to hear how passionate you are about this. And I hope that we get some new followers to bring them along on your journey as well, and also inspire them to find their own journeys and their own paths. Thank you very much.
Thank you.